Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the inferior mesenteric artery. The inferior mesenteric artery, also called IMA, is a ventral branch of the abdominal aorta. Ventral means anterior branch of the abdominal aorta and supplies blood to the distal part of the large intestine. So this is an artery for the hindgut. We have the artery for the foregut, the celiac trunk, artery for the midgut, the superior mesenteric artery. Origin of inferior mesenteric artery, it originates from the anterior aspect of the abdominal aorta at about the level of lumbar vertebra 3. Its course, after its origin, the inferior mesenteric artery courses inferiorly and to the left within the retroperitoneal space, supplying branches that serve the left colic flexure, also called splenic flexure, where the transverse column becomes the descending column, sigmoid column, rectum, and upper part of the anal canal up to the pectinate line. The inferior mesenteric artery supplies blood to the structure which are hindgut derivative, like the splenic flexure or left colic flexure, descending column, sigmoid column, rectum, and upper part of the anal canal, we can say up to the level of the pectinate line. So if you look at the blood supply of the gastrointestinal system, we have three ventral branches. One is celiac trunk for the foregut derivatives, superior mesenteric artery for the midgut derivative. Part of the midgut has been taken out, like the jejunum and ileum. Okay, and the inferior mesenteric artery supplies the hindgut derivatives, like the left colic flexure or splenic flexure, the descending column, the sigmoid column, rectum, and anal canal up to the pectinate line. Okay, so this is the inferior mesenteric artery. This is the inferior mesenteric artery, which is a branch of the abdominal aorta from the anterior aspect or ventral aspect. We have three ventral branches. Inferior mesenteric artery is one of them, and it supplies the splenic flexure, the descending column, the sigmoid column, the rectum, and anal canal up to the level of pectinate line. Okay. So this inferior mesenteric artery it has branches like the left colic artery, that is again the ascending branch and descending branch. Then it has 2 to 4 sigmoid arteries, supplies the sigmoid column. Then we'll get the branch superior rectal artery that supplies the rectum and upper part of the anal canal, anastomosed with the inferior rectal artery and middle rectal artery. The ascending branch of the left colic artery, again anastomosed with the superior mesenteric artery through the marginal artery. Okay, marginal artery of Drummond. Marginal artery is also called juxtacolic artery. It is also present in the transverse column, just inferior to the transverse column, just to the right to the left of the ascending column. Okay, and this marginal artery make an anastomotic channel between the anastomotic channel between the inferior mesenteric artery and superior mesenteric artery. This artery is also called artery of Drummond, and it is vulnerable to ischemic changes, particularly in the watershed area, junction between the transverse column and the descending column area. We have multiple vascular arcade, we are saying, and also some straight arteries supplying the large intestine. So let's go again to the branches of the inferior mesenteric artery. The left colic artery is the first major branch heading towards the descending column. It further divides into ascending and descending branches, anastomosing with the branches of the middle colic artery. from superior mesenteric artery through marginal artery. There should be a gap here. Okay, marginal artery of Drummond, helping to maintain a continuous blood supply along the colon. Sigmoid arteries, these arteries, usually 2 to 4 in number, branch of the inferior mesenteric artery and supply the sigmoid colon. They form arcades which help provide collateral circulation to this region of the colon. Suprarectal artery, terminal branch of the inferior mesenteric artery, supplying blood to the rectum and upper part of the anal canal up to the pectinate line. Okay. It anastomosis with the middle rectal artery from the internal iliac artery and inferior rectal artery from the internal pudendal artery. There is a branch of the internal pudendal artery. This is a branch of the internal iliac artery. Clinical importance of inferior mesenteric artery. Inferior mesenteric artery may go through ischemic changes due to the inferior mesenteric artery role in blood supply. Obstruction can lead to ischemic colitis, particularly in the watershed area like the splenic flexure. So after a heavy meal, person may have pain in the colon. We call it colic, the mesenteric colic. Aneurysm significant if they occur, especially given the inferior mesenteric artery's origin from the abdominal aorta. Abdominal aortic aneurysm may displace and compress the inferior mesenteric artery. Thrombosis may develop. All of them may lead to mesenteric ischemia and mesenteric colic. And also, inferior mesenteric artery may go through atherosclerosis as a part of atherosclerotic process of the aorta and other blood vessels. Surgical implication during procedures like colectomies, careful identification and preservation or ligation of inferior mesenteric artery and its branches are essential to maintain appropriate blood supply to the remaining segment of the colon. And that's all about the inferior mesenteric artery. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.